60 Minutes Overtime.
We're here at the CDC as we're about to enter the third year of the pandemic, and we're going to answer some of the top questions you've been asking us over the past 2 years. So I can shake your hand. Dr. Arjun Srinivasan is an epidemiologist at the CDC and a captain in the United States Public Health Service. What does the new normal look like?
I think the new normal looks very much like it does now. We're able to get back to gathering with friends, with loved ones. We're able to travel, to do some of these things that we love, but we're always vigilant. And we're ready to reach for things like masks, for vaccines when we need them. I think our new normal is a heightened state of awareness about infections and how they can be spread, and an increased ability to respond rapidly to them.
There's brand new mask guidance. What are the kind of things that people should be thinking about?
In areas where transmission community levels are low, so the green areas, and even in the medium areas, it is, per our recommendations, it is safe to be in indoor spaces with other people without having to wear a mask. It's your personal preference. But if you're going into a healthcare facility, you're going to visit that loved one in a nursing home or in a hospital, those are people who are vulnerable, and we want to do everything we can to protect them. Wear a mask. If you're going to a nursing home, going to a hospital, always wear a mask.
If people want the maximum protection, what kind of mask should they be wearing?
We are lucky now that we're in a situation where those types of masks that you wore in the healthcare facility, those N95 respirators or the international KN95 respirators, those supplies are much more abundant
Or
now.
KF94.
That's right. Those masks do provide the very highest level of protection, and so we do encourage people who are at high risk to reach for those masks because they do provide the highest level of protection.
How long do you expect to see home testing or even PCRs in a facility being part of American life?
I would hope that testing for these types of viral infections like COVID, like flu, becomes the new norm. One of the things that's been transformational during COVID is the ability to go and get that test, and within 15 or 20 minutes, you have an answer. So I really hope that these types of tests that people can do right in a doctor's office or even at home become the new norm in helping us manage respiratory infections like COVID, like flu.
What therapeutics do you see coming down the line?
I'm excited about the new therapeutics, the oral pills for COVID. They actually attack the virus and prevent it from dividing in your body and causing a worse infection. I think those are going to be fantastic options for people who have mild and moderate disease so that they don't have to be hospitalized. It's been remarkable what's been done over the past 2 years.